Check out the full episode of the Bendy Bodies podcast on your favorite podcast app.
Yeah, they could be very helpful. What about advice on addressing sexual dysfunction like lack of sex drive or inability to orgasm caused by POTS and dysautonomia, especially when taking beta blockers? That's a pretty specific question.
Yeah. You got to work on pleasure. Pleasure. What feels good? Double down on what feels good. And you can see a sex med doctor. You know, there are off-label, there's no on-label orgasm medications. But I always think like, what can I change? What can I tweak? How are your hormones, right? Are you using vaginal estrogen? Have you used a vibrator? Do you think that sex is just putting something in your vagina, right? Like there's so much to cover that it's really just start getting an education. Because remember, 100% of people, unless they had an amazing mom, did not get sex ed.
Mm-hmm.
You got a disease and pregnancy prevention plan, you did not get sex ed. So there, people are like, oh, I have POTS and I'm on a beta blocker. Bad, that's how it is. It's like, yeah, but you're missing 90% of all the other things that you can improve on.
Mm-hmm. And speaking of, could you talk a little bit about the drug Addyi, the medication Addyi, and or that other class of medications that is designed to help with desire in women, right? Is that what it's for? Okay.
Yeah. So Addyi's the brand name. The generic is Flibanserin. And then the other, so that's once daily dosing taken at night. And then the other one is an injectable on demand called Vyleesi, or the generic is Bremelanotide. They've both been FDA approved for low desire in premenopausal women for years. Not widely utilized for two reasons. Number one, nobody knows about them. Number two, insurance is awful because insurance says sexual health isn't health and we don't want to cover it. So both of the medications work. They're both very safe. All medications have side effects. So, it irks me when people are like, is it safe? And I'm like, well, cars aren't safe, right? But we use them every day. But they're relatively safe for most people on most days.
Right.
So, but they kill 100,000 people a year.
Right.
So, the is it safe is always kind of like a trigger word for people like, oh, you don't understand that like all medications have risks, but it doesn't mean you're going to get a risk, right? So risks are dizziness, nausea for the injectable one. The bigger risks, for bigger meaning more common, for Addyi is slight weight loss and better sleep. So some would argue that those are not that bad. Don't drink more than 2 glasses of alcohol in a night. If you take Addyi, then skip a dose just because it can lower blood pressure. But the big myth is that you can't drink at all. Now, I would argue drinking is actually very bad for sex life and for health overall. So what are you doing? But for people who enjoy that, just don't drink more than 2 in a day. And what else can I tell you about them? They work by increasing dopamine. So dopamine is the neurotransmitter in our brain that makes you want to seek something out. I want to go get some Haagen-Dazs mint chip. I want to go scroll on my phone. I want to go get sexual activity. That is the dopamine pathway. So those 2 medications work by increasing dopamine, increasing your interest in sex, and then hormones also increase the dopamine pathway. And that's why both estrogen and testosterone are known to increase desire.
And those are only approved, though, in premenopausal women?
That's true.
Those medications?
They do work in postmenopausal women. And I'm like, do you think that your insurance company or the pharmacy is going to like come to your house and see if you have tampons in the closet? Like, people get so hung up on that. And I'm like, most people don't know if they're in menopause or not, if they're like 52 and had a hysterectomy. So I'm not going to ride that line super hard. And we have data that it works in postmenopausal. Addyi is approved in postmenopausal in Canada. So the drug companies aren't saying it didn't work. It does work in postmenopausal. Postmenopausal women have dopamine pathways too. The FDA put an artificial line in the sand.
Really? So it's not that they're unsafe in postmenopausal women?
Correct. It's that the FDA thinks there's a big difference between postmenopausal and premenopausal women. And remember, definition of menopause is arbitrary and made up. A man said it's 12 months after your last period. Why not 6 months? Why not 18 months?
Right.
Why not 12 months in a day? So at the end of the day, the definition of menopause is arbitrary.
And it sounds like the FDA thinks that it's not important for women to have sex or desire sex then, because that doesn't make any sense if it's still safe in postmenopausal women.
There was somebody at the FDA who was quoted as saying, "What do we need a bunch of horny women walking around for?" Keep in mind, they FDA approved Viagra in 1998, and it was considered an essential advancement for men.
Even right away?
Bias is real, my friends.
Yeah. Wow. That's incredible.
90% of men are heterosexual. So who's taking care of who they're supposed to be sleeping with?
Check out the full Bendy Bodies podcast episode on your favorite podcast app.